It's as powerful as Cool Sculpting as far as we've been able to see, and the fat doesn't regrow with heat like we've seen it regrow with this. Now, Cool Sculpting, we love it. I got a lot of friends, a lot of colleagues have been using it for years, and they love it. The problem is now these patients are coming back years later. Not all of them, but a few of them going, where did this come from? Including one good friend of mine, big section that regrew.
How much does this usually cost? Not
Those
like,
machines are about $200,000.
yeah, but like for the services, for the sessions, like
If you're trying to completely, now per little area, $1,000, it's not bad. But if you're trying to complete maybe full abdomen and flanks, 2 treatments, around $8,000.
and this is if you don't want to get surgery.
Correct.
Okay.
We're trying to showcase, we couldn't even begin. This is maybe a fourth of all the equipment that we use.
Mm-hmm.
We're just trying to give you guys an idea of what we have to do to deliver state-of-the-art results. It's not cheap.
Yeah.
Trust me, I'm not saying that just because I'm just trying to get paid. We all want to get paid, okay? But to do this, to have this equipment, to deliver these kind of results, and most importantly, do it safely, cosmetic surgery, if you're doing mommy makeovers, should be at a minimum somewhere around 12, so 11, 12, all the way up to 25. If you're trying to do breast aug, lift, lipo, tuck, get your scar revised, looking good, that's what it should cost.
Somebody on my live has a question for you guys. How much does your center charge for a tummy tuck and a scar revision?
So
if you don't mind answering what they said.
it depends. Some of it's going to be on BMI, okay? But if you're just coming in and someone's a thinner BMI, so it's going to be a lot quicker, again, it could start out somewhere just like 11, 12.
Okay.
If they want the 4-liter maximum, okay, let's put it like this. I got a question. What do y'all think the average BMI of a woman is in the United States?
32, 36.
You're very close. It's like 30.6, something like that.
Yeah.
Okay? The average BMI that's turned down right now in the United States, turned down, is 30.
Yep.
So the average woman is being turned down.
Right.
We can easily treat up to 35 as long as a few things. There's not too much fat beneath the muscles. If you have a beer belly, okay, you know what I'm talking about?
And it's hard, guys. You see the big beard guys, they say, look at my abs, they're hard.
Right.
That's all visceral fat.
Right.
It's all fat around the liver, around the intestines. We can't get that. That's diet, exercise, lifestyle change.
Right.
Yeah. So if you guys are, we wanted to be able to have solutions. So we have a hormone wellness center that will look at your hormones, be able to adjust those real weight loss pills. Things like Qsimia. There's other powerful things we can use. That they're like state of the art. But if you just go get phentermine, what's the problem with phentermine?
You gain weight after you finish.
There you go. You will lose the weight. You will lose the weight. And then 3 months later, you have to start phentermine. You have to stop it because it will blow out your heart valves.
Yeah.
And then what will happen is then you'll gain the weight back.
Oh wait! Oh my God! Those are the diet pills?
Yeah.
Yeah.
I
And
just
you'll
ordered
gain it right back.
My mom just yeah. Oh my
The
God.
doctors prescribe it to you.
So bad. I did good.
Yes, it's bad. So they'll try lower doses that aren't as bad for your heart, but then it doesn't work as effectively. Then you get the higher doses.
I was
that are
thinking it's
bad
better
for
to
your
get it from there than order
Do
online.
you feel that people who have lipo, I feel like for me, I was always thin, but once I got lipo, I realized that I was getting weight faster when I had surgery.
Uh-huh.
I don't know, maybe it's the lifestyle, I don't know, but I feel like I'm gaining weight in other places that I didn't have before. But I don't know if that's just a part of age or is it because of the liposuction, so they suck it out of one place and it's growing fat. And do you guys see that often? Or I feel
Absolutely.
like the more lipo I get, the more I need it.
Well,
But that's what happens when you do lipo. You gain weight right
Well,
after.
you
don't
So you have to
necessarily-
keep up
Yeah,
working
yeah.
out. You can go to the gym. You can't just go eat
Maintain the same
McDonald's.
lifestyle,
Right.
number
Yeah.
one. Number two, when you do get lipo in your belly,
Yeah.
the fat that you do gain is going to go to the next most common place.
Your butt.
It could be chin, it could be butt,
Yeah.
it could be
It's different
arms.
for everybody.
Yeah, it's different for everybody.
Well, we
My
have
doctor
like,
didn't tell me that.
and this is the thing. So we have like, like the butt shots. What happens is the fat goes there because that's where it knows to go. If you notice, that's where like your butt grows when you gain weight. My butt gets bigger and bigger.
Well, if it's done right and someone goes aggressive, we all have these high def techniques that we talk about here where we get after it. We get that level thin. Plus, use microneedling RF to make the skin shrink, that Silverman, make your stretch mark shrink. Use erbiums to research the skin. CO2s, the J plasma, yes, microneedling, and that's the best in the business. We could go on and on and on. What we have to throw the kitchen sink of technology at you guys, but that's what I'm talking about. If you want all the technology and you want the best results and you want to have a safe procedure, it